Hello and welcome. My name is Raj Persaud. I'm a consultant psychiatrist based in private practice in central London in the United Kingdom. And I'm delighted to be joined today by Anna Ruddle. And we're going to be talking a bit about therapist self-disclosure. This is therapists talking about themselves in therapy. And this is kind of like a taboo subject in the whole world of therapy, psychology and psychiatry. Anna Ruddle is a clinical psychologist working for the South London and Maudsley NHS Trust. She works as a full-time clinician in a community team for people experiencing psychosis and bipolar affective disorder. She has previously published work on her interest in hearing voices groups and also sits on the National Committee for the British Psychological Society's Faculty of Psychosis and Complex Mental Health. Today, though, I've invited her to talk about an article she's written for The Psychologist, which is a journal that goes to members of the British Psychological Society. And she's written this article with her colleague, Sarah Dilks. This article addresses the topic of therapist self-disclosure, whether therapists should share information about themselves with their clients in therapy. So let me start by asking you, Anna, why did you decide to write about this topic?
Well, firstly, Raj, thanks for inviting me today. It's a topic kind of quite close to my heart. And the reason I'm writing about it is something I've grappled with since the start of my training as a psychologist, really, always trying to find a line between being myself and being a therapist in the room. And I never really felt there was a safe space to talk about these issues in training. It wasn't routinely discussed. Like you say, it was a bit of a taboo topic that was generally discouraged. And since qualifying, I've worked for a number of years with people experiencing psychosis, and I've quickly seen the value and sometimes actually the necessity for sharing information about myself in therapy. So myself and Sarah asked around some other psychologists working in psychosis, and it turns out everybody's doing this, but nobody's really talking about it. So we decided we wanted to kind of raise the profile a bit, I suppose.
So in a way, it sounds like you're saying that you believe that some kinds of therapist self-disclosure done in a certain context with the right sort of training and techniques are actually an advantage, and not to do it in some situations is a disadvantage.
Yeah, no, we do believe that. And actually, I'll come to talk about some of the literature and the research, which does suggest that that is the case. I think we've gone too long now with the view that it's always a disadvantage. And I think we're missing opportunities or potentially doing it badly without giving it proper thought and attention.
Okay, so what is therapist self-disclosure? Could you give us some examples?
Yeah, it's a good question because I think definitions and understandings do vary. So some of the kind of recovery literature out there seems to indicate that by therapist self-disclosure, we're just talking about clinicians disclosing their past experience of mental health problems or of major adversity. Other literature implies that it has to be some disclosure of kind of major personal facts about yourself, like your address or, the names of your kids and where they go to school. But we're not talking about just those kind of really major details. We're talking about a broader definition, almost on a continuum. So there is the kind of information about yourself and your life, both personal and professional. So maybe whether you've got children or why you need to cancel a session the following week. And that stuff's called extra therapy or non-immediate self-disclosure. It's about something not immediately in the room. But we are also considering another kind of self-disclosure, which is about sharing your own thoughts and feelings in therapy with your client, like telling someone why you're asking certain questions or how they're making you feel in the room. And that's called intratherapy or immediate self-disclosure because it's about what's going on immediately in the therapy session.
Okay, and so could you say a little bit more about different types of self-disclosure?
So there's those kind of immediate and non-immediate, but you can kind of carve it up in different ways. So there's what we might call reactive self-disclosure. So that's where somebody asks you something out of the blue and you're forced to have to grapple there and then about what information to disclose. And that's quite different to what we might call voluntary self-disclosure, where you actually plan and choose to share something of yourself with a client. And there's also positive or negative self-disclosure. So you might share with someone you're feeling that they're very resilient and strong, that they've been through a lot, versus telling them that when they get caught up in their anxiety, it makes it very hard for you to think straight and do your job properly. So there could be positive and negative. And of course, there's degrees of personal information. So I sometimes share with people that I've known lots of Arsenal fans in the past, that I've, got lots of friends that are Arsenal fans. That would be a different degree of intimacy to sharing, I live with my husband and he's an Arsenal season ticket holder, so I know the team well. So there's kind of different degrees of kind of intimacy as well with what you share.
How much therapist self-disclosure is there out there going on?
Well, that's a good question, and we don't really know the answer because it's not actually very well researched. One of the best studies that we cite in our paper by Henretti and Levitt, it suggests about 90% of people are disclosing, which, given it's hardly spoken about, is astounding. And actually, all the people I've ever asked say they do it to some degree. I think it just varies, and people have very different therapist styles. So I think how much it's being done and in what context very much depends on the model of therapy, the therapist's preference, their experience, and the individual person that they're working with. And I think it's also important, you asked how much is it happening, but actually it's not so much about the frequency. It's the literature suggests it's more important kind of what's being said, when and why, rather than how often it's happening.
And what's the history of self-disclosure? Why did it become a taboo subject? Does this go back to psychoanalysis and the fact that the therapist was meant to be slightly remote and aloof and not really talk very much?
Well, exactly. All the things you've just said, but you kind of have to ask, well, why was that? And I suppose the reason cited in early psychoanalysis was that the therapist needed to be neutral and a blank slate. And the reason for that was so that the client could project, so kind of impose all of their innermost thoughts and feelings on that therapist without any hindrance or kind of barrier. And the argument was that if the therapist started to reveal anything about themselves, then that kind of muddied the water a bit and made it difficult for the client to genuinely use them wholly as a neutral blank slate. But from there, I kind of feel that therapist self-disclosure, like you say, it's kind of tumbled into this massive taboo subject with an even kind of graver reputation than that warranted. It's almost seen as unprofessional or as poor practice, sometimes even kind of dangerous, like you're opening yourself up to a vulnerability or scrutiny by the client that I actually think is quite unfounded.
What would you say are the disadvantages of therapist self-disclosure?
I mean, I think I have to, acknowledge there are some, and there's times where I've got it wrong. And so for me, it's about saying the right thing at the right time to the right person. So for me, the disadvantages come when you haven't really properly thought about it and considered kind of the context in that moment in therapy and what the consequences might be. And of course, sometimes we can have thought about all of that context. We can have thought about our individual client and the moment, and we still have a different outcome to what we anticipate. So some of the possible disadvantages, you can imagine sometimes we might share information about ourselves that might invoke some jealousy or envy in the client, and then they don't feel able to be completely honest about their difficulties. We might also shift the focus of therapy a bit too far towards the therapist, where suddenly the client is there kind of feeling they need to think about us and worry about us and hold us in mind. And that's sort of a barrier to therapy. And I have to admit, I've also had the situation, as I'm sure most of us have, where we answer a question and that fuels another question. And then suddenly we get ourselves very stuck in a line of kind of fire that we hadn't anticipated, and we don't know how to kind of rein it in. So that can be a bit of a disadvantage.
What would you say are the advantages of therapist self-disclosure?
I think there's a whole host of advantages. I mean, the paper we cite lists a whole range of them. But for me, the fundamental thing is about building a relationship with someone, kind of fostering an alliance early on, and sharing that information about yourself can make you seem human and reduce the power imbalance between you. And that often leads to the client then disclosing more things about themselves, which might be important in therapy. I mean, in psychosis, it's particularly important for helping to normalize people's difficulties, especially when people are experiencing things like voices or strange beliefs, and they really feel that they're the only one. Sharing that you've, occasionally felt a bit paranoid, that everybody's talking about you, can be very kind of reassuring. And I remember working with a client once where we were trying to make sense together of how he'd come to believe there was this big conspiracy to harm him. And we talked through his kind of upbringing and his life history. And I shared with him that that if I'd grown up with the abuse and the lack of support that he had, then I would probably be looking up for threats all the time. And I might have come to believe there was a conspiracy as well. And when I said this, he actually had tears in his eyes. And you could see that he just suddenly felt, I'm not that weird. This really could happen to anybody. And I think if I just said to him, maybe you believe there's a conspiracy because of all the abuse you had growing up, it wouldn't have had quite that same effect. There was something about me sharing that I too could have had those thoughts and feelings if I'd been there, and making it personal that meant it really meant something to him.
So one of the themes is you seem to be arguing that therapist self-disclosure plays a role in engaging the patient.
Yeah. I think it's, especially in the work that I do with people experiencing psychosis, if you imagine somebody comes into the room and they, believe wholeheartedly that there's a government conspiracy to harm them, they're petrified that the police are involved and that the NHS might be sending copies of their notes to the Prime Minister, they're not going to come in and start telling me about their innermost kind of thoughts and feelings. They'll be thinking I'm about to send that information off to the government. So for me as a therapist in that moment, I have to tread so carefully and get to know that person in order to support them to feel safe to talk. And so to start with, I will talk about anything and everything that will get them talking. So if that means talking about what we both watched on the TV, some of our shared interests, just to show that I'm a normal person and I'm not out to harm them, that I want to help them, I'll do that. And I'll also be honest with them about why I'm asking them what I'm asking. People can get very paranoid about the lines of questioning you're asking. So I'll explain exactly why I'm doing what I'm doing to try and reduce any kind of sense of suspiciousness. And over time, those moments of, I think, self-disclosure can help somebody see that I'm, a benevolent person that wants to help them.
Are there some therapies that even advocate therapist self-disclosure?
That's a good question. There aren't many therapies that really talk about it in a lot of detail, but some do more than others. So, for instance, in systemic family therapy, often they use a reflecting team model, and that's where a few team members will comment on what they've seen in the family session in front of the family. And when they do that, they're encouraged to situate their comments in their own personal context. So, for instance, if I was a family therapist, I might say, I could really connect with the mother in the family there because I remember feeling really lost when my son left home. So that is a model of therapy that does sometimes kind of cite personal context. And there's other forms that take it a bit further. So narrative therapy practice has this model called the Tree of Life, where therapists reveal all sorts of information about themselves and their backgrounds to clients in order to then expect them to do the same. So there's a real kind of equality in the therapy. But CBT, cognitive behavior therapy, which is obviously the most kind of commonly practiced therapy, actually says very little about it. There's some more recent third wave kind of CBT approaches like acceptance and commitment therapy that say a little bit more and kind of advocate therapists modeling when they're finding things difficult, or that we all have kind of uncomfortable thoughts and feelings sometimes, and that's a normal human experience. But it's still very, very little talked about or written about. It kind of gets the odd paragraph in a whole textbook.
What's the research evidence on the impact of therapist self-disclosure?
I mean, the research evidence is quite sparse, to be honest. There's a couple of good studies that sort of review the literature, but the problem is a lot of the studies aren't real life therapy situations. So they're surveys of therapists, or they're experimental studies where people are asked to imagine a kind of mock therapy situation. So all the evidence should be kind of taken with a bit of a pinch of salt, but most of it suggests that therapist self-disclosure is generally viewed as a good thing. It has a positive impact, especially when it's used infrequently, so not too often, and at a low to moderate intimacy. And another thing that's interesting is generally, I talked earlier about the immediate, non-immediate self-disclosure, and generally the immediate self-disclosure, so therapists sharing their kind of thoughts and feelings as they arise in the room, is viewed kind of a bit more positively than the non-immediate, so those kind of bits of personal information about yourselves. So I think we need to be a bit more tentative with the latter. And it seems to make clients perceive the therapist as warmer, but not necessarily more empathic or having a greater regard for the client. And there are a couple of good qualitative studies out there as well, which kind of highlight some of the themes I've been talking about kind of connecting with clients early on and engaging in a meaningful relationship.
So, final question, what would your advice be to therapists on how and when and why to do self-disclosure?
I think my main advice would be to think before you speak. I know it sounds cliche, but I really think in therapy, it's about asking yourself, why am I about to say this and what impact do I think it will have? Sometimes we feel compelled to self-disclose. And when we get that feeling as a therapist, often that's the time where actually it's unlikely to be helpful because we haven't really thought it through, the consequences. And I think it's about asking yourself to consider all the relevant information in that context. So the who's, the what's, the when's, the why's and how's. So asking yourself, who am I disclosing to? For some people, this will be helpful and some not. So what is your formulation of that person at that time? And what information do I really need to give at this point? When? Well, there are different moments in therapy, and I certainly think a bit of light disclosure at the early stage of therapy is good for engagement, but maybe not too much intimate stuff. Whereas at the end of therapy, you can take more risks. You're ending the relationship anyway, and actually some more sort of intimate self-disclosure can be really helpful at those times. I think the why is important. So how does it fit with your current therapy goals and what are you hoping to achieve? And finally, the how. So you might want to consider whether you're going to do it in a planned way, whether you're even going to ask the client permission. Is it okay if I share something about myself? And most importantly, asking them afterwards, how was it to hear something about myself there? How did that feel? And then to maybe ask them again later in therapy.
Anna Ruddle, thank you very much indeed.
Thank you, Raj. It's been a pleasure.